Epidemiology of precancerous and cancerous lesion diagnosed in early cancer detection unit in 30 years. The unit was established by Professor Dr. Muhammad Samour in 1981, being the first and leading unit in the field of early cancer detection in Egypt. All specimens received by the unit was 232,917 cases. The unit started by cytological examination of gynae and non-gynae specimen and pathological evaluation. Colposcopy and hysteroscopy were introduced in 1985 and 1986. Fine needle aspiration began in 1991. The aim is to examine to focus on the cancerous and precancerous gynecological lesion confirmed by pathology, focusing on descriptive epidemiology. Out of 94,805 cases of histopathology, 10% were reported to be precancerous and 4.6% as malignant tumors. 57% of the specimens received were from the endometrium, 17% from hysterectomies, 11% from cervix, and 6% from the ovary. 64% of precancerous lesions recorded were from the uterine body, 34% were from the cervix, and 1% from the ovary. Most of pre-malignant cases belongs to the group aged from 40 to 50 years, followed by the group from 30 to 40. The mean age of all precancerous tumor was 45 years. Ovarian and cervical pre-malignant lesion showed statistically significant lower age when compared to other group, while the vulvar and vaginal pre-malignant lesion was the highest. Simple endometrial hyperplasia without cytological atypia form 86% of precancerous lesion of endometrial carcinoma. Precancerous lesion of squamous carcinoma were greater than the glandular, with the low-grade SIL showing the majority of cases. A typical proliferating serous tumor showing 55% of borderline ovarian tumor. On comparing the precancerous lesion, endometrium showed 11%, the cervical was 4%, and the ovarian was 0.6%. They show a constant rise along the years till 2011. Of pre-malignant lesion of the vulva, the low-grade SIL showing the highest grade. Out of all malignant cases encountered in early cancer detection unit, the endometrium shows the highest site percentage, followed by the cervix and the ovary. 78% of cases were from Cairo. On comparing the time trend of malignant tumor, the cervix show 1.4% of all cases underwent histopathological examination. Uterine body is 1.2%, and the ovary was 0.9%. A difference was observed in the first year. The cervical malignancy was higher than the uterine in the first 10 years, and this rate was inversed in the last 15 years. Most of cases belongs to the age group from 50 to 60. The age at diagnosis was 50 years, with a minimum of 8 and maximum of 96. Choriocarcinoma and ovarian tumor shows the least the younger age, and the endometrium and the vulva show a statistically higher age. The median delivery was 4, with a minimum of 0 and maximum of 14. 40% of cases with no children, and other 40 with para 3. 87% of cases were married with an average age of 51. Of all endometrial carcinoma detected, endometrial carcinoma shows 87% of cases, followed by metastatic, 6.7%. For cervical tumor, squamous cell carcinoma was encountered as the highest majority. From malignant ovarian tumor of the surface epithelium showing 73%. The highest was serous carcinoma and the least was Brenner. 36% of malignant tumor show bilaterality, and as for metastatic tumor, almost half